Is it sore over here?
It's the medial side.
Oh, okay. What happened?
Good question. I was running, I planted my foot like this, and then I pushed off, and then it just kind of tweaked it. And then, yeah, it just got really bad.
Okay. If you push this way onto my hand, do you have pain with that?
Yeah, it feels really weak too.
Where do you feel the pain?
Just on this side.
Okay. If you hold up towards your knee and don't let me pull you down, do you have pain with that?
Yeah. Same place.
Okay. So maybe it's around here. So this might be like a tendon strain for tib ant. Or even, you know, you might find like rolling the muscle here could be helpful to like take some tension down, and maybe those pain tests go away. Yeah, but over here on your ankle sprain that's acute and swollen, we're gonna do our taping for some anti-swelling. And so we just kind of wanted to show what that looks like. This is something that you can apply to any area that's sort of swelling. And so you might call this like squid strips. We take a strip of tape, and we can cut it into like 3 to 4 bands. So if we're gonna go for 4, we'll just cut straight down the center, and then that one in half again, and in half again. Same deal over here. Maybe we'll do this one in 3 just for fun. So the idea is that it's gonna help to draw some of the swelling towards the anchor point. And so if we're swelling here in a lateral ankle sprain, we're gonna aim to sort of create almost like an X pattern that goes over top of that area. If this is somebody who's got like a really serious ankle sprain and everything is swollen around both sides, we could do this on both sides, but we're just gonna show it on the one. So we're just taking some light tension, maybe 25%, and kind of winding that down. So the idea is that it's gonna help you to manipulate the skin and facilitate drainage of the swelling. And so the neat thing is that after having had this on, when like bruising starts to emerge and everything starts turning purple and stuff like that, then as you take this off, you'll actually see wherever the tape was, the skin is like normal skin color, it's not purple. So it really, you can visually see that it's helping to clear that area out. There are lots of kind of like, kinesiotape lateral ankle sprain images and stuff like that online that you can find. Yep, and it also makes for like exceptional tan lines. So that's basically it, right? But if you had like a big quad contusion, big bruise, we could do it up on the quad, right? If you just have big bruise, any area that's kind of like you want to treat some swelling, we can put that on, and it just helps to kind of manipulate the skin. Generally, people feel pretty comfortable with it. It's something that it's going to be easy to stay on. Can stay on for 3 to 5 days sometimes. In an ankle sprain, we might do that in addition to compression. And maybe if I wanted to just show one more thing. You want to put your foot over there again. So my sort of instructions for you to help facilitate getting that swelling down would be, you can first start working with your toes, like toe curls and extensions. And so this tends to be pain-free. In a smaller range of motion, you can move the ankle for whatever feels kind of comfortable for you. And so we can actually see this is manipulating the skin as well. This is gonna, like the exercise itself, with or without the tape job, is gonna help you to kind of get some drainage. And so we wanna be doing this kind of thing like 5 minutes out of every hour. Or just like gentle, walking, or if you need to be on crutches, then we're assisting that walking pattern. The other thing that we can do is wrap it with a tensor or with a voodoo floss band or just a regular TheraBand like we're doing here. And so like you can tell me if it's painful, but we're gonna kind of tension that as much as it feels comfortable. And so as we wrap that around, this is gonna have an anti-swelling effect as well. So when we, you know, if you're comfortable, we're able to wrap that pretty tight. And then you can try, so I'm just gonna hold this for you now. If you're gonna do this on your own, you could just tuck it in, like under here, but right now I'll just hold it. You can try moving your foot up and down. So it restricts your motion a little bit. It kind of puts more pressure on the swelling, stuff like that. You just wanna move in the range that feels comfortable and tolerable. So you could go up and down, you could go side to side, you could do like ABCs, whatever, kind of different movements and stuff like that. And that's just helping to kind of pump stuff out. We'll keep this on for about 2 minutes. If it's done up pretty tight, it's gonna start driving you crazy. You might feel like you're losing circulation or blood flow to your toes. And that's okay, because we're only gonna keep it on for 2 minutes, and then you kind of take it off. You can do this for like 5 rounds in a row, and but you can also generally do the technique about 5 times a day. So if you do 5 rounds in a row, it's a really thorough treatment. If you're trying to aim to do 5 times a day, not all of them are gonna be that thorough. Sometimes you'll just do it once, and that's still gonna have a benefit. You wake up first thing in the morning and it's really stiff and you're taking your first few steps, like this kind of thing is really, really gonna help, all right? So as long as there's still like swelling that's affecting your range of motion, we can use those techniques.